piling in, but I want to go ahead and get started, so we can have your attention, please. On behalf of the Kansas State Nurses Association, I'm pleased to welcome you to the 34th Annual Day of the Legislature. I'm Craig Gunther, Chairperson of the Nurses Day of the Legislature Event Committee, as well as a board member and lobbyist for KSNA. It is our challenge as nurses and citizens to stay individually informed and come together as a whole to institute the best public policy changes possible for the health care of our communities and the institutions where we care for our clients. As President John Kennedy once said, one person can make a difference, and everyone should try. I am honored to introduce a special guest this morning. Governor Mark Parkinson became Kansas's 45th governor on April 28, 2009. A successful businessman and former legislator, Parkinson is a native Kansan with roots in Scottsdale. He is a graduate of Wichita State University and earned his law degree at the University of Kansas. Please give a warm KSNA welcome to Governor Mark Parkinson.
Well, thank you very much. And I feel like I'm at a high school commencement here. This is a great turnout. I will tell you that there are a lot of associations that bring members up, particularly in the first 5 or 6 weeks of the session. But I can't think of a single organization that's brought this many members up. So you all are to be congratulated. I came here a couple of years ago as Lieutenant Governor to open the conference and to welcome you here and welcome you to this day. And I told you about how it was kind of unusual to be Lieutenant Governor because no one knew who the Lieutenant Governor was. And so I was able to kind of walk around the state government and work on the issues that I was working on, and no one had any idea who I was. What I quickly learned was that if you don't get elected to become governor, but if you become governor because the governor goes to be the Secretary of Health and Human Services, still nobody knows who you are. And I quickly learned that the first week that Stacy and I and the kids moved into Cedar Crest. We like pizza, so we called the local Pizza Hut and tried to get Pizza Hut delivery. And they asked us the address, and we told them. They said, "Okay, this is a joke, right?" I said, "No." They said, "What's your name?" "Mark Parkinson." "Well, we think the governor's Kathleen Sebelius." "No, I'm actually the governor, so I actually deliver pizza." Well, anyway, people are starting to figure it out a little bit. Although around the state I'm not known that well, which in light of all the budget cuts that I've been forced to make, I think that's actually a good thing. And people have started to figure it out. There are a couple of issues that I want to talk with you about today that are very, very important to the health community that you can make a significant impact on this year. And so as you're over here today, headed over to the Capitol, as you see legislators, I hope that you will talk to them about these 2 issues. If you don't have a chance to talk to your legislators today, I would really encourage you, when you get back to your hometowns, to contact your legislators and talk with them about these 2 issues, because they are very, very important to the health community. The first is a statewide public smoking ban. 28 states across this country have been smart enough to enact a public smoking ban. It's not a radical idea. States like North Carolina, which is the largest producing tobacco state in the country, have enacted a public smoking ban. We haven't been able to do it in Kansas. We haven't been able to do it because the tobacco lobby is very strong and very powerful and has hired many lobbyists to keep this from happening. Even though over 70% of Kansans want the legislature to adopt this legislation. The Senate has passed it. It's called House Bill 2221. The Senate has passed it. We need the House to vote to pass it as well. The vote is extremely close, and it's quite likely that action will occur on this very soon. So as soon as you can talk to your legislators about the importance of passing this bill, it would be terrific. We know that 4,000 Kansans die a year of cigarette smoking. We know that 380 Kansans die a year of secondhand smoke. We know that in communities that have banned public smoking, heart attacks and strokes have gone down. It's an important public policy issue. It's an important health issue. and I hope you'll work with me in working with the legislature to finally get this done. The second issue is the budget. The Kansas budget has been dramatically cut because of our drop in revenues. We have about a $6.5 billion budget. We've had to cut out $1 billion. And that affects your industry in two ways. First, we've had to make a 10% cut to Medicaid reimbursement rates. This has had a terrible effect on hospitals and an even worse effect on nursing homes that have high Medicaid populations. We've cut as much as we can. I've taken the position that we need to stop cutting. If we need to raise revenue to prop up these programs as we work our way out of the recession, it's incredibly important that we do so. The second way it affects you is the nursing schools. We've had to cut significant amounts of money out of our aid to regents, which has impacted the nursing schools and their ability to graduate as many nurses as we're going to need for the future. So this year, my welcome is really unlike my welcome 2 years ago, where there frankly weren't significant health issues for you to lobby on. This year, we really need your help. Both of these issues are quite close, and the impact of 1,000 people, the number of people in this room, contacting their legislators could be enormous. So I hope you'll join me in my efforts to make Kansans safer and healthier through the legislature, and I very much appreciate your lifelong commitment to make Kansans healthier by your chosen profession. Thank you all, and welcome to Topeka.